Thank you very much. Well, this is a 2-year project. This is the first opening meeting. This kind of kick-off meeting. We will conduct the project over 2024 and 2025. This is a project of technical cooperation with International Atomic Energy Agency. We also cooperate with the Ministry of Health and all entities interested in tissue response in radiological procedures. The Polish title, well, you can see the title in English, Preventing Tissue Reactions in Interventional Procedures. What's the objective of the project? Well, the main objective of the project is to raise the awareness of the personnel involved in interventional radiology, because we want to promote procedures that offer radiation protection to patients. And I would like to give you some facts. Well, of course, interventional radiology is a field, interventional radiology that using ionizing radiation is a procedure that interferes with human body, and there are and it is sometimes more useful in certain clinical cases. I'd like just to tell you that in 2020, 40% of our population were people over 50. This is the fact that is often discussed also in other fields. We are an aging population, unfortunately. Unfortunately, among these 40% of people aged 50 plus, 1/4 of these people are people who are obese. Their BMI index is above 30. This is also important when we speak of radiological protection. You will hear 2 diverse presentations today and over the project where attention will be drawn to the fact that people who are obese, they pose real challenge in radiological protection of patients and the staff. And another fact which is also relevant is the fact that speaking of the cause of death, especially in the group aged 50 plus, almost 40% of all deaths are caused by cardiovascular disease. So this is quite a big proportion. So prevention of these diseases is very important. If we assume that in Poland we carry out around 700,000 diagnostic and interventional procedures, and they take place in over 700 interventional radiology units. Out of these 700,000 procedures, 80% are cardiovascular procedures. And because our cardiovascular diseases are causes of almost 40% of death cases. And besides some obvious facts, when we speak of the application of interventional radiology procedures, I would like to draw your attention to these procedures that you can see on the slide, because they may lead to the application, to the use of higher doses to the patients, which in cases of prolonged duration may lead to unwanted effects. That is, we may expect them, but we don't want them. But on the other hand, they don't always result in skin damage. So you can see here all the entire list of procedures that are mentioned here. Strokes, there is an entire list here on the slide of potentially of procedures which are important from the point of view of radiological protection. What may impact the exposure, the patient's exposure? I'm not discussing medical aspects. I'm telling you why this project is necessary to increase the awareness of the fact that patients' radiological protection should become part of this practice. So what may increase patients' exposure? It's the size of, is the patient himself or herself, the size of the patient, because that decides also on the amount of absorbed dose. Well, there are also cases when it's hard to plan interventional radiology procedure. So a procedure may take much longer than we expected, and the longer it takes, the bigger dose can be administered, and that may lead to unwanted effects. Well, procedures may also relate to organs that are more radiosensitive than other organs, which also may lead to some undesirable consequences. And last here on the list, but not least, is the situation when procedures are repeated within a relatively short period of time. We don't say specifically here what time span is seen as a short time, but it's between a couple of days until several days. If a procedure is repeated, that may lead to deterministic effects of radiation. Another aspect is the fact that from data that we have, we know that patients who are over 55 and patients suffering from chronic diseases are less resistant to radiation injuries. That means that that they may develop consequences of exposure which in other patients don't appear. When it comes to Poland, our rough estimates connected with the number of interventional radiology procedures, we estimate that we may expect up to 200 cases of adverse radiation effects in medical exposure per year. Is it a lot or not? I'd like to remind you that annually 700,000 procedures are carried out, and medical procedures are advancing, and this is 200, that's a rough estimate. These data come from some years ago, so maybe progress has been made, so the real number is smaller. Of course, there are regulations which oblige each and every interventional radiology unit to control the doses and of course to supervise them if they exceed certain thresholds. But the most important issue is that interventional radiology procedures are intended to save life and health and improve health of our patients. So effects, especially skin responses, if they appear as a result of such procedures, they make part of this procedure. So they sometimes cannot be avoided if you perform a procedure that is intended to produce a certain therapeutic effect, that is, or to save the life of the patient. So we must be aware of the fact that such effects, deterministic effects, that they may appear. So we have to carry out these procedures in a way that embraces and takes account of the safety of the patient. And the objectives of our project. After this brief introduction that has given us a broad picture of interventional radiology procedures and how they are carried out in Poland. These are the objectives related to the POL9028 project. First of all, we want to integrate the activities of all institutions and units engaged in the project, not just the medical units, but also state sanitary inspection, to increase the awareness of personnel involved in interventional radiation procedures, to promote patients' protection as part of good medical practice. We don't want to treat it separately from the medical part of the procedure. We don't want to divide it into two ways. That is, we have medical procedure and we have radiological protection. This should be seen together to achieve a proper therapeutic or diagnostic effect. We need to act in a way that is, we need to use radiological procedures safely. And also this project is intended to conduct the national survey on deterministic effects related to interventional protocols. This, we hope that as a result of this survey, we will be able to make these numbers, for example, these 200 cases, these rough estimates, to make them more accurate, to make them more realistic, to show what these numbers really are in Poland. That's also part of our project, that is this first national survey that would answer this question. And also, under this project, we would like to create what we call a simulation center at our National Center for Radiological Protection in Medicine, in healthcare. We want to have such center to train professionals in interventional radiology procedures was also with the use of visualization of virtual radiation field, which creates the working environment for the staff who work in and perform such procedures. So this would be a device that is not using a real source of ionizing radiation. This is just the visualization of radiation. So we may visualize these procedures and the good practice by combining these two aspects to find out how and at what technical parameters of shields of the lamp, for example, what the radiation field we get, because this radiation field impacts our stuff. And another aspect that we want to achieve through this project is having a dosimetry system, individual personal dosimetry system, a real-time personal dosimetry system. The system that would be mobile, which means that if you can use this simulation center and see what this simulation looks like, how these procedures, medical procedures are simulated, and how it impacts the exposure of the staff and the patient in this simulated environment. So when after this training you have this personal dosimetry system, this mobile real-time personal dosimetry system, you will be able to find out what it looks like in your particular working environment, and this time in real life. This would be a system that we would be making available to all parties interested working together with us in this project.
When it comes to practical activities, I have already mentioned a survey on deterministic effects. Another practical activity includes assistance of the International Atomic Energy Agency to train, to prepare people using a phantom, a training phantom that will be purchased under project funding, so they'll be able to practice interventional radiology procedures. We will also organize workshops on medical exposure and professional exposure. I will say something that is obvious to you. Medical exposure and professional exposure in interventional radiology are very strongly interconnected. It's obvious that source of radiation to the staff is the patient himself or herself when we look at some procedures, but in general, it's the patient who is the source of ionizing radiation to personnel. We will be also having a speech on deterministic effects. You will hear some information on the biology of occurrence of deterministic effects. We will also cover the topic of statistics, how to deal with the radiation risks. I would like to remind and tell some of you, I don't know, when we had a conference with the lecture on deterministic effects, and there was a speech by a US patient who was telling us how he kept asking physicians to help him when he noticed an extensive erythema negative effect, and the doctors didn't want to listen to him, so the hospital conducted the procedure, radiological procedure. He had burns, specific burns. You cannot treat them using traditional dermatological measures. They are ineffective. So we need to have a knowledge on the type of effects and how to deal with them. So I think it will be an interesting element of the workshops. Equipment, modern equipment is another important feature of the project. We will be talking about artificial intelligence in interventional radiology. We cannot avoid it also in interventional radiology. I have mentioned 200 cases, so I will be referring to these 200 cases. So modern equipment supports the staff not only in the aspects relating to the medical applications of ionizing radiation, but also in the aspects of radiological protection. So the artificial intelligence and modern equipment, or the other way around, and the personnel will translate into medical effectiveness of these procedures. It will also contribute to the patient's safety. There will be a smaller probability of occurrence of negative effects of interventional radiology. And the other two aspects I would like to emphasize in terms of interventional radiology, these are the issues of ethics. It's the issue of communication of the doctor, medical personnel with the patient. It's very important, specifically in these areas where high doses are expected. I'm sure you know such cases. Patients who have some dental exams from the perspective of radiological protection. Well, of course, there is some ionizing radiation applied, but it's when we talk about radiological protection, it is much greater for interventional radiology or some other procedures. So patients are exposed to ionizing radiations, and when we're talking about interventional radiology, the ethical aspects are very important to the patients. He should receive appropriate information in the appropriate manner. So this will be a value added to the good practice. Good practice is not just in terms of medicine. It covers different measures that are components of the good practice, and the ethical aspects, these relations between personnel, medical personnel and patients are also very important. And communication of risk. I'm sure you have your own experience how to communicate risk caused by ionizing radiation. People are afraid of this radiation. They immediately think of Hiroshima, Fukushima, Nagasaki. So these are the terms that come to our mind as first when we talk about ionizing radiation. Without this radiation, you cannot have good medicine. Without the ionizing radiation, you cannot perform a majority of interventional procedures. So the radiation has to be high enough. We always talking about risk when we're talking about radiation. So we have to know how to explain it to the patient. It's not only about giving them some numbers, values. We have just read on a device, on a meter used for interventional radiology. So you give this number to this patient. Patient then checks Google, and then very often becomes confused, and they are not that trustworthy. Sometimes they have doubts that maybe somebody didn't tell them the correct information, and maybe the information on the risk was reduced. Under our project, we are also planning several visits, scientific visits. So some of you will be able to go to some selected good international centers. It will be funded under the project, so you will be able to see, to verify your skills, to have some discussions on the good practices in interventional radiology and radiological protection. I would also like to stress the participation in conferences, congresses, different workshops that will be funded if some charges will be involved. So they will be funded under this project. So I would like to encourage you to take part in the project, to follow its development, to be able to benefit from the project. So you will be able to take part in dedicated workshops that will be held under the project. Next year, you will be able to use the phantoms in our simulation centers. You will be practice your skills. And this year and next year, under our project, if you have some justified needs in taking part in some conferences, congresses, or some workshops, you will be able to be supported under this project. Procurement. Under this project, we have planned two main purchases. It's the simulation center and the dosimetry system, real-time dosimetry system, mobile dosimetry system. So you will be able to use these tools in your work. So these are two major purchases. We will be able to do the shopping by the end of April, to make sure that next year we will be able to have the installation and launch the first training courses organized in the simulation center and mobile dosimetry system. Under this project, following some discussions, especially with Professor Walecki, we have selected two centers. We would like them to be our reference centers. And we will test our project in practice in this center. So this is the Ministry of the Inferior and Administration Hospital in Warsaw, the Institute of the Polish Mothers Health Center in Łódź, Upper Silesian Medical Center of the Medical University of Silesia in Katowice, and University Hospital in Kraków. So these are the 4 centers that will be involved in the project implementation. However, I would still like to ask you to propose the participation of your centers to take part in the projects to obtain as many benefits as possible, benefits to you. And the project budget. President Głowacki from the National Atomic Energy Agency has mentioned that it's quite a significant budget. It's for the amount of over 5,000 euros, so it's a huge budget. Here you have some information. Take a look at the 3rd column, the meetings workshop column, so you can see some concrete amounts for you, for your participation in the study visits and participation in conferences, meetings, and scientific visits. We also have money for them. So in 2024, we have planned your participation in conferences and scientific visits. It's over 50,000 euro, just under 50,000 euro. In 2025, it's some 40,000 euros. So these are major amounts for you. So if you wish to take part in some events on interventional radiology and ionizing radiation, then you are welcome to receive the project support. And the biggest part is for the purchases. They will take place in the financial year 2025, but we will be ready for the purchases this year. So hopefully there won't be any obstacles to do the shopping if we do not conduct the procurement. Then the project will not reach its objective. So that's all from me. When it comes to the project presentations, are there any questions or comments? Director is very modest. He didn't say that this project inspired by their international agency, but we've been discussing this initiative for a long time. The project was an inspiration from Director Kluszczyński. This is a unique project, the first project of this type that has a very holistic scope when addressing radiological protection and safety, all the risks caused by interventional radiology. So actually, I don't understand why we didn't think of such project before, because, as Director Kluszczyński was saying, interventional radiology causes highest risks. So I think it's a great achievement that you have planned this project. It's the first project of this type. Am I right? I would like to stress it. Secondly, I have this feeling that we will also talk about the apparatus used for interventional radiology. When we talk about magnetic resonance or computed tomography, we can use different types of equipment, but when we are talking about interventional radiology, the equipment must be modern. The exams are very short. And of course, we think of the exposure to personnel and patients. So if the equipment is of poor quality, the exposure is longer and it affects skin tissues. This is a major problem addressed by this project. And a brief comment on artificial intelligence. There are two aspects when artificial intelligence will be helpful, and we shouldn't be afraid. So it improves acquisition of the images in these modern systems. AI reduces noises and improves quality. So we perform procedures using this apparatus. And the second aspect is the application of AI in robotics. Robotics is starting to be used in interventional radiologies and, Da Vinci system. So there are some robots for vascular procedures. For companies offer this equipment, and without artificial intelligence, robotics wouldn't be able to be used in surgery and in intervention. So these are the 3 comments from me. So congratulations for developing this project. It's very important.
Thank you, Professor Żenia. Any comments from you?
Thank you very much, Dariusz. First of all, good morning, everyone. I want to also congratulate the National Center for proposing such an important project. And just one comment, although I will discuss this later in my presentation. Although the title of the project focuses on the avoiding tissue reactions, I believe that the project will contribute to much more, to improving, reducing all risks in interventional procedure, risk for patients, but risk for staff. Because as we will discuss in more details this afternoon, in fact, we can't separate patient protection from staff protection and from the medical benefit. In fact, radiation protection should be an integral part of the clinical benefit for patients. I really believe that this project will contribute to improving patient care in Poland. Thank you.
Thank you, Żenia. Yes, for sure, it's much broader than the title point out. This is the idea to do that.